وبالنسبة للبروجكتس تاعتكم وزعوها بيناتكم. بدي كل جروب يعني أكون عارف شو البروجكت اللي عملوها.
إن شاء الله.
طيب خلينا نبلش المحاضرة. فأول شيء رح نبلش بالوند هيلينج. طالع السلايدات عندكم صح؟
دكتور طالعة.
Okay, تمام. So we're going to talk about wound healing, the process of wound healing, types of wound healing, شو الأشياء that promote and شو الأشياء that inhibit or delay wound healing. كل هاي الأشياء are really important for you. طيب ليش في صدى صوت؟ ليش في صدى؟ So healing is the body response to injury and attempt to restore normal structure and function. So the aim is to retain the normal structure and function. هلا في two types of healing processes, the regeneration and repair. انتوا بتعرفوا اي واحد فيكم بنجرح او بيحصل له تروما, he will have a scar, يعني ندبة بعد التروما. And this is part of the healing process. هلا في some tissues that heal without scarring, and it's the ultimate and finest form of healing. And there's complete restoration of structure and function without without scar formation. This is called regeneration. Okay, so if we have complete restoration of structure and function without scar formation, this is called regeneration. Repair is restoring structure and function but with scar formation. Okay, واضح الفرق بين الريبير والريجنريشن؟
واضح.
تمام. هلا بدكم تعرفوا انه there are some important growth factors that are essential and play a vital role in the process of regeneration, like vasculoendothelial growth factor, platelet-derived growth factor, fibroblast growth factor, and epithelial growth factor. هذول كلياتهم they are important growth factors that work together in order to promote the process of regeneration. هلا in order حكينا repair في عنا ندبة, والندبة means granulation tissue and contraction of the wound. So if we have a scar, we will have granulation tissue formation. عارفين شو granulation tissue؟ Okay, راح افرجيكم صور granulation tissue. So granulation tissue formation and contraction of the wounds. شو يعني contraction of the wounds؟ يعني إذا عندنا wound وعندنا two edges of the incision, contraction is done by myofibroblasts to bring the wound edges together. فهو in order to decrease the gap between the wound edges, what happens? The myofibroblasts pull the edges together. هلا there are many cells that play an important role in the wound healing, but the most important and most vital is macrophages. So wound healing can never happen without macrophages. Okay. هلا عندنا الكلاسيفيكيشن of wounds وعندنا you need to know what's acute wounds. Acute wounds acute wounds they are wounds that heal within 3 months. هلا in general بالsurgery when we talk about something acute we are talking about less than 2 weeks. بس بالنسبة للwounds it's 3 months. Okay, so because there are many processes that work in sequence in order to have a completely healed wound with restoration of structure and function, and this does not happen in 2 weeks, it takes 3 months. بس in general يعني إذا إحنا بنحكي بالsurgery acute we mostly mean less than 2 weeks except in wounds. هلا the end result is a well-healed wound. هلا well-healed wound it does not mean that a wound without a scar لأنه كل الwounds فيهم scar unless it is healing by regeneration. بس the scar في scar different. Some people heal with an ugly scar, some people heal with a nice scar. وهسه راح نحكي شو الأشياء اللي affects scar formation. هلا chronic wounds مرق عليكم انتم سمعتوا بأني chronic wound؟ ولا شكلكم بعدكم نايمين. اشربوا قهوة، اشربوا اسبريسو أو شيء.
ممكن هاي اللي بتكون عند مرضى السكري مثلا في الديابيتك.
So yeah, diabetic foot ulcers, venous ulcers, bed sores. هذول المرضى اللي بصير عندهم تقرحات سريرية نتيجة إنه they are bedridden. So these are examples of chronic wounds. Why they are called chronic wounds? Because they did not heal within 3 months. هاي واحد. The other thing, because they did not heal in the sequential pattern that we are going to talk about it later now. A sequence of events is not going through each and every sequence of the wound healing. هلا حكينا هاي ال wound healing phases. هلا in order to have the wound healing nicely it needs to go through 4 phases of wound healing. هسه راح نحكي عنهم. أول شيء phase of injury اللي هي بس يصير عندنا injury يعني لما يصير عندنا incision أو لما بنعمل لما واحد بيحصل له تروما بصير أول شيء اللي هو hemostasis. So hemostasis, what's the aim of this process is to stop bleeding. فأول شيء بصير vasoconstriction, platelet aggregation, then later leukocyte migration. هلا the aim of this phase of wound healing, hemostasis, is to stop bleeding. Okay, so whenever you have an injury بصير أول شيء vasoconstriction, بعدين platelet aggregation, بعدين leukocyte migration. هلا الphase of inflammation. شو يعني inflammation? Inflammation means red angry wound. هلا what does that mean? It means that there's some essential cells that are trying to clear the debris and clean the wound. Okay, فبصير inflammatory phase. Inflammatory phase مزعج. Okay, because إيش macrophages are trying to clear all the debris. So the aim of this phase of wound healing is to clean all the debris. Okay, the most essential cell is macrophage. هلا proliferation, once we have a nice clean bed for healing بصير عندنا tissue proliferation. The proliferation, the most important thing is fibroblasts. So fibroblasts proliferate, epidermal cells migrate, and granulation tissue formation. هلا once we have for proliferation of and formation of granulation tissue, then we have to organize that granulation tissue in the process of remodeling. وهون بتغير عنا التايب اوف كولاجين. هلا what's the most common type of collagen in the body؟
type 4
collagen 4 دكتور.
1
type 1 الموست abundant، صح ولا لا؟
صحيح.
هلا what happens in the process of wound healing؟ هلا type 1 الريشيو تاعه is 4 to 1 بالنسبة لتايب 3. هلا early in wound healing type 3 predominates. Later on in the process of this remodeling we're trying to bring type 1 as the predominant collagen. Okay, so بيختلف الريشيو as we go through the stages or the phases of wound healing in order to bring the wound back to normal tissue ratio in terms of collagen. هلا هاي again to re-emphasize what I have already said: hemostasis, stop bleeding, inflammation, chemotaxis اللي هو هنا الphase inflammation, red angry wound. It's trying to clear all the debris, clean the bed and make it ready for the proliferative phase. وproliferation في عنا epithelial migration وبعدين بالcontraction or remodeling اللي هو الcollagen. We are trying to organize things in order to restore as much as possible the normal structure and function of the tissue. وهاي كمان مشان انتو تراجعوها على السيلولار ليفل. هلا اللي بدي تعرفوه انه لازم تعرفوا شو ال predominant cells in each phase of wound healing. اللي لازم تعرفوه، اللي ما بدي تعرفوه انه راح تلاقوا انه ال phases of wound healing في from inflammatory phase او hemostasis from day 1 to day 4. هاي it's different from one book to another, so مش راح يعني اركز كثير. They overlap. They are not mutually exclusive. They in one wound you will find some parts of the wound in the inflammatory phase while others are in the proliferative phase. So in different parts of the wounds you will find different phases. واضحة شو اللي بحكيه؟
واضح دكتور.
هلا الاشي اللي بدي تعرفوه انه early on بصير vasoconstriction to stop bleeding، بس بالinflammatory phase بصير vasodilatation. Okay, so vasodilatation happens in the inflammatory phase to clear the debris and bring substrates to provide a platform for tissue proliferation later. اوكي هلا هاي انا شرحت لكم كل فيز على السريع، بس هاي مشانكم انتم تدرسوها. هلا البروليفراتيف فيز you need to know انه فيها angiogenesis, fibroplasia لانه حكينا الفايبروبلاست is the most important، وعندنا epithelialization. هلا cross linking of collagen requires vitamin C. هاي انا so if we have deficiency in vitamin C شو ممكن يصير عندنا مرض؟
سكيربي ممكن.
صح. so هاي الاشياء مهمة. هلا
دكتور عفوا بس ما سمعت شو المرض؟
سكيرفي. اوكي هلا الريموديلينج فيز اللي هي حكينا انه we are trying to bring the collagen back to its normal ratio. حكينا الريشيو type 1 is the most predominant. Then as we go through the phases of wound healing we are trying to bring that normal ratio into to the ratio of uninjured or unaffected skin, okay, or tissue. هلا tensile strength of the wound early on depends on fibrin. وهي الفايبرين اذا انتم بتلاحظوا على الوند، بعرفش اذا انتم لساتس اللي شرحت لهم المره الماضيه على شو انا اعطيتكم المره الماضيه بالراوند
عن الدي في تي والفينس بروبلمز يعني.
So early on, fibrin, it's a gelatinous proteinaceous layer produced by the wound in order to seal it. زي يعني زي السيليكون، يعني على إذا سامعين بالسيليكون، عارفين شو السيليكون؟
دكتور.
هلا هاي أهميتها إنه البيشنت بيقول لك دكتور متى بقدر أتحمم بعد العملية؟ Why is that? Because this produces a watertight sealing or isolation of the wound. هلا متى الجواب بيعتمد على انه احنا بنعرف الphases of wound healing, so he can have a bath after 48 hours. Okay, a shower, he can have a shower after 48 hours after the operation. Later on, the collagen cross-linking provides the strength of the wound. هلا tensile strength of any injured structure is حتى مع best form of healing is not equal to pre-wounded structure, فبكون weaker. The most in its most fine healing it reaches 80% only. Okay, حكينا هاي انه الكولاجين النورمال البريدومينانت تايب is type 1, والريشيو النورمال سكين collagen ratio from type 1 to type 3 is 4:1. So type 1 is 4 times more than type 3. هلا as we go through the wound healing بيكون type 3 early on is the most predominant, then type 1 becomes as in the phase of remodeling. هلا هون types of collagen, where are they found? You need to know where when the types of collagen are found. هلا عادة لما يكون عندنا delayed wound healing أو problem in the wound healing, it's in the problem إنه الwound is stuck in the phase of inflammation, مش راضي يمشي. حكينا أول شيء phase of hemostasis، بعدين phase of inflammation، بعدين proliferation، بعدين remodeling. هلا وين المشكلة؟ إذا إحنا بدنا نحط دائرة وين المشكلة عادة بتكون بالphase of inflammation. واضحة so far؟
واضحة دكتور.
هلا انتم بتعرفوا حكينا عن التايبس اوف wounds acute and chronic wounds. هلا التايبس اوف wound healing بتعرفوا شو يعني primary intention؟
لا.
هلا primary intention means when we close إذا واحد بيعمل عملية بنعمل incision and we close the edges of the wound by sutures. So this is healing by primary intention. Secondary intention إنه إحنا فتحنا جرح بس ما سكرنا وخلينا to go through the phases of wound healing and heal on its own. Tertiary intention اللي هو اسمها tertiary intention اللي هو اسمها delayed primary. شو يعني؟ عندنا wound can is not clean, so we kept on doing dressing. We didn't close it at the start, so it's not primary intention. بس لما صار نظيف رحنا سكرناه بسوتشرز after 5 days. هلا متى احنا بنسكر wound؟ primary intention, secondary intention or tertiary. هلا primary intention all يعني most of surgical elective surgical interventions، يعني واحد عامل هيرنيا، واحد عامل thyroid surgery، واحد عامل breast operation, we close the wound because first of all the wound is fresh, clean, and there's no foreign bodies or dirty elements in the wound. هلا secondary intention إذا كان عندنا واحد عنده abscess أو في pus أو في debris أو حادث سير أو في dirt or debris in the wound, we cannot close it لأنه راح يصير إيش؟ infection. So what we need to do is to keep on dressing, cleaning the wound, give it good irrigation, and then leave it to go through the normal process of healing granulation tissue اللي هن الphases of wound healing اللي حكينا عنهم قبل. هلا secondary intention takes long time to heal. The other thing, it heals with scar formation, and the scar is usually worse or uglier than primary or delayed or tertiary intention. هلا tertiary intention, if we had a dirty wound ونظفناه وتعاملنا معاه ب proper dressing every day, and then the wound after a few days it looks clean and nice, then I can bring the edges together. So this is called delayed primary healing. واضحة شو الفرق بيناتهم؟
دكتور عندي سؤال.
تفضل.
البيرن بيشنتس ايش بنعملهم، برايمري ولا سكندري ولا تيرشري؟
البيرن حسب الستيج of the burn، وعادة we leave them to heal by secondary intention. Okay. So البيرن is a different issue. بس هسه إذا واحد حكى لك abscess شو بتعمل له؟ Which type? Secondary.
Tertiary.
Secondary. You leave it for secondary healing intention. هلا شو الفرق بين primary intention؟ حكينا لكم بالبرايمري بنسكر الwound edges by a suture، وعادة هذول fresh wounds, clean wounds. They don't have any debris. There's no foreign body, and they are surgical incisions اللي احنا بنعملهم السيرجنز بيعملوهم. اوكي سو مش بروح بنعمل لواحد زي عملية وبنخلي الوند مفتوح No, we close it most of the time. هلا secondary intention إذا في عندنا cavity and this cavity has pus, dirt, or it's contaminated, we cannot close it. What we leave it to heal by contraction. So the wound edges they contract by ايش؟ myofibroblasts وبصير epithelialization. هلا tertiary احنا شو عملنا؟ عملنا dressing on this wound which was really dirty and unclean, and then it became fine and clean with no debris, and it has healthy granulation tissue. Then we can approximate the edges by sutures. هلا why do we do this؟ مشان نقلل الايش؟ الوقت for healing, in order to decrease the time for healing. Okay, and to result in better scar formation. واضحة؟
واضحة دكتور، واضحة.
تمام. هلا راح تسمعوا انه بالسيرجري في عنا clean surgery، في عنا clean contaminated، وعنا contaminated، وعنا dirty wounds. هلا في حد بيعرف شو معنى clean surgery؟ So clean wound, if it's atraumatic, uninfected, and there's no entry of the genitourinary, GI or respiratory tract. شو يعني؟ زي ما نعمل thyroid surgery, we did not go through the genitourinary system, we didn't go through the GI system or the respiratory. شو كمان clean wound? Breast surgery. Okay, so we didn't go through any of those. So why is it called the clean؟ لأنه the risk of wound infection is low, is 1 to 2%. هلا السؤال هون ليش قسموا الwounds لهيك؟ This classification in order to know when to give prophylactic antibiotics. When is it indicated? هلا بالclean wounds, do you think we give prophylactic antibiotics?
No.
No.
No, we don't need to give, except in certain cases. في حد بيقدر يسمي لي certain cases where we need to give prophylactic antibiotics even in clean wound?
Immunocompromised.
So بالضبط immune compromised patients. شو كمان؟
إذا الوند نفسه الاريا تبعته كبيرة؟
لا.
دكتور
if there's foreign body
في انفكشن على المكان الوند او كذا.
if we are putting a foreign body شو يعني واحد عامل total knee replacement بدنا نحط له new knee so this is we are putting a prosthetic material so we need to give prophylactic antibiotics. Hernia surgery we are putting a mesh. It's a foreign body, so we give prophylactic antibiotics. هلا in certain high risk surgeries like what? Vascular operation. يعني أنا إذا بدي أعمل عملية على الكاروتيد artery so we need to give prophylactic antibiotics even it's a clean operation but we don't want أو واحد عامل على brain surgery so neurosurgeon is doing a brain surgery. It's a clean operation, but still we give antibiotics because it's in a high risk area. Because if infection happens, it will be a catastrophe. طيب هاي خلصنا منها واضحة صح clean ones. هلا clean contaminated ones اللي هو there's minor break in sterile technique. Entry of the genitourinary system يعني عمليات المسالك الGI or respiratory tract without significant spillage. هلا risk of perioperative or post-operative wound infection is less than 10%. So like cholecystectomy is a clean contaminated wound. هلا contaminated wounds is traumatic wounds with gross spillage from the GI tract. يعني واحد عنده intestinal obstruction I'm doing an operation on the intestine for resection صار في عندنا spillage of stool. This is contaminated wound. Dirty wounds are any wounds involving an abscess. So if there's any abscess so الابندكس خلينا ناخذ مثال على الابندكس. الابندكس can range from a clean contaminated wound to a dirty wound depending on the phases of appendicitis. إذا كانت أول شيء in the first phase of catarrhal phase of appendicitis بتعرفوا شو يعني catarrhal؟
دكتور
شو يعني؟
يكون انفلاميشن على الميوكس ممبرين
يعني زي المرشحة يعني الابندكس زي الابندكس انها مرشحة فاهمين كيف علي؟ So high early on in the phase of appendicitis there's minor break in the sterile technique with the entry of the GI but without significant spillage. هلا إذا كانت هاي الابندكس perforated معناته contaminated wound. إذا كان في عندنا appendicular abscess معناته this is a dirty wound. okay عرفتوا شو الفرق؟
دكتور ممكن تعيد آخر إشياء اللي هو الكونتامينيتد والديرتي.
هلا الديرتي أي إشي فيه عمل this is a dirty wound. هلا شو يعني؟ الابندسايتس انتوا بتعرفوا الابندسايتس هو أكثر إشي سيرجيكال يعني لازم تكونوا عارفينه. الابندسايتس can range from a clean contaminated operation to a dirty operation. How is that? هلا إذا أنتوا اكتشفتوا الابندسايتس early on بالكتارال phase يعني إحنا كتارال يعني مرشحب في بداية الابندسايتس there's minor break in the sterile technique and without significant spillage. So this is considered a clean contaminated wound. هلا إذا الابندسايتس أنت لما رحت اكتشفت this patient has appendicitis has a perforated appendix معناته في spillage and gross spillage يعني صار في perforation أو contamination so this is a contaminated wound. هلا إذا رحت ولقيت في abscess formation أو pus معناته this is a dirty wound. واضحة؟
دكتور واضحة شكرا.
تمام. هلا factors affecting wound healing. شو في عندكم factors انتوا you think ليش مثلا في واحد heals better than the other؟ احكوا لي شو انتوا بتفكروا.
platelets count.
نعم.
platelet count ممكن.
البليتلت كاونت
انه يعني ما عندهم انه الناس اللي عندهم مثلا ثرومبوسايتوبينيا
لا ما لهاش دخل. شو غير هاي الاشي؟
comorbidities
البلاد
like
كلوت.
diabetic patient ممكن diabetes.
اياه اول شيء خلينا نحكي عن الايج. اياه احسن الهيلينج بالصغار بالعمر ولا بالكبار؟
الصغار.
طبعا. نحكي عن الكوموربيديتيز patients with diabetes. تسمعوا جدتي بتعرف انه اذا مريض عنده سكري بتطول جرحه تيطيب، صح ولا لا؟
صح.
الاشياء ففي اشياء انا شو بدي اقسمهم. اذا patient related factors like age, comorbidities, immune compromised، كل الاشياء هاي. and ايش local wound related factors. فايش local factors؟ اذا في tension على edges of the wound، اذا في foreign body، اذا صار في عندنا infection، اذا صار في عندنا ischemia بالedges of the wound، اذا عندنا hematoma or seroma collection. تعرفوا شو يعني هيماتوما؟ يعني في blood collection within the wound. seroma if there's lymphatic collection in the wound. إذا في عنا edema or irradiation wound متعرض ل radiotherapy. هاي local factors كلياتها تؤثر. so tension يعني إذا الإدجز بعاد عن بعض وأنا رحت جبت سوتشر حاولت أقربهم راح يصير too much tension on the edges and this will lead to affect wound healing. foreign body إذا ما نظفنا الوند كويس. infection واضحة الأشياء هاي. هلا systemic factors اللي هي patient related factors زي ما أنتم حكيتوا age DM patients with uremia اللي هم renal failure patients on steroids patients بأخذوا chemotherapy tobacco smoking hypothermia, malnutrition, jaundice. Even jaundice affects wound healing. So malnourished patients. So واضحة الأشياء هاي؟
واضحة دكتور.
فأنا دائما لما بسألكم سؤال بحب أنا رابعة يعني في البداية يكونوا مرتبين، بحيث إنه مثلا لما أقول لكم شو الأشياء اللي they affect the wound healing تحكوا لي patient related factors or systemic factors and local related factors to the wound. أوكي؟ هيك بتكون الأمور أرتب الإجابة. هلا مشان تحفظوهم في friends وفي didn't heal you can use this or that. هلا أنا هون شارح لكم كيف الهايبوكسي affects wound healing. I will leave it for you to read. مش فيش داعي أقرأ لكم إياهم هذا الإشي. الإشي الثاني بدي تفرقوا between 3 مصطلحات infection, contamination و colonization. هلا infection شو يعني؟ في عنا بكتيريا والبكتيريا هاي عددها أكثر من 100,000 per جرام. بس إحنا مش مشان نحكي infection we have to go and count the bacteria. But if the wound looks infected شو signs اللي ممكن تكون على الwound if it's infected؟
pus maybe.
redness, warmth, hotness, swelling, loss of function.
بالضبط ممتاز. so أول شيء بيكون عندنا signs of inflammation اللي هن color وربر ودلر وتيومر اللي هن celsius signs of inflammation اللي انتم حكيتوهم. زائد بيكون في عندنا discharge والdischarge is copious and purulent discharge يعني purulent يعني pus أو ممكن يكون smelly. أوكي so هاي local factors. systemic factors ممكن يكون في عندنا fever the patient is not feeling well أو إذا diabetic بيكون عنده uncontrolled blood sugar. هاي معناها infection. هلا contamination إذا إحنا أخذنا culture from a wound وطلع في not pure growth more than one bacterial growth هاي مرات بتكون contamination by skin flora. هلا إذا colonization إذا في عنا wound وأخذنا منه مسحة وهاي المسحة طلعت عنا بكتيريا بس there are no signs of inflammation. The patient is systemically well, he's not unwell, there's no fever, there's no loss of appetite, blood sugar is completely controlled. هاي بيكون في colonization. of the wound. واضحة شو الفرق بيناتهم؟
إيش الفرق بين colonization والcontamination؟ مش كتير واضحة.
الكولونايزيشن بدنا نفرقها مع الانفكشن. هلا الانفكشن والكولونايزيشن في عندنا بكتيريا، بس البكتيريا هاي عملت لنا مشاكل بالانفكشن. في عندنا signs of inflammation, there's discharge, the wound is red, it's hot, the patient is unwell, the blood sugar is uncontrolled. هلا this is infected wound. هلا إذا عندنا wound عادي it looks fine but I took a wound culture، أخذت منه مسحة للزراعة مشان أتأكد شو في بكتيريا ولا لا، وطلع عنا في موجود بكتيريا، بس this bacteria is not causing any problems in terms of inflammatory, it's not producing any inflammatory signs and the patient is not affected systemically. واضحة؟
تمام.
تمام. هلا كل الفاكتورز affect wound healing, but surprisingly anemia does not affect wound healing unless the hematocrit is really low. Okay, so mild to moderate normovolemic anemia does not appear to affect wound healing unless the hematocrit is below 15. Metabolic disorders, uncontrolled diabetes result. هلا diabetes ليش بيحكوا إنه diabetic patients they don't have nice healing؟ لأنه it affects all the phases of wound healing, from inflammatory phase to proliferative phase to collagen remodeling phase. So it affects all the phases of wound healing, and therefore they have delayed wound healing, and most of their wounds they don't heal within 3 months. اللي هم acute wounds, they become chronic wounds. طيب malnutrition. إذا بتعرفوا خاصة البنات بيعرفوا إنه كل السبلمنتس تاعت الهير فيها فيتامين سي وزنك وفيتامين إي، هذول كلياتهم are really essential for wound healing. وإذا بتعرفوا في كمان vitamins, skin, nail and hair، هذول ال supplements they have vitamin C, zinc, they are all important cofactors for wound healing. هلا in general الاشي اللي بيهمنا بالمajor operations and in surgery is the protein level. So if the patient has hypoalbuminemia or hypoproteinemia, this will affect wound healing. الكانسر له أكثر من يعني way to affect wound healing. أول شيء the increased demands of cancer cells, they need more nutrition, and this will they will take normal tissue nutrition, so they will affect the balance. الإشي الثاني they can affect the appetite of the patient. هذول معظم patients اللي عندهم cancer they have loss of appetite، ما بأكلوا كويس، so they are malnourished. وفي more than one pathway how they can affect wound healing. So I will leave it for you to read. The steroids, they affect all phases of wound healing. But the good news, في عنا antidotes of the patients on steroids. I can give vitamin A, and it can reverse all the detrimental effects of steroids apart from its effect on contraction of the wounds. Okay, so vitamin A will help to reverse all the aspects, all the adverse aspects of steroids apart from contraction of the wound. Radiation, again, it can lead early on to stasis and occlusion in the small vessels. هذول المرضى cancer patients who have radiotherapy, it can cause occlusion of the small capillary vessels, and this will lead to ischemia. Later on, it causes fibrosis and tissue scarring, and this will affect the healing, wound healing. هلا complications of chronic wounds. إذا واحد عنده chronic wound، جرح فاتح for a long time, you should think of this can lead to osteomyelitis. It can lead to infection reaching the bone. It can sometimes be related to unrecognized malignancy, or it can lead to malignant transformation. And this is called Marjolin's ulcer. So Marjolin's ulcer or Marjolin's transformation. If we have a chronic ulcer, بتحول لsquamous cell carcinoma most commonly, and sometimes into basal cell carcinoma. Or if there's an unhealing wound despite addressing all the risk factors, يعني إذا عنده malnourishment, I gave him good nutrition. If the patient is diabetic, I controlled his diabetes, and the wound's still not healing, you should think of malignancy. High syndromes associated with abnormal wound healing, I will leave it for you to memorize and read. هلا زي ما عندنا defect in wound healing, في عندنا sometimes excessive wound healing. يعني excessive scarring, صار more wound healing than we require. هلا الأمثلة عليها بالجي آي اللي هو الادهيجنز. لما احنا بنعمل operation on the bowel, you get adhesions, التصاقات between the bowels. or إذا بنعمل surgery على التندونز، العظام، يعني أطباء العظام الأورثو بيعملوا surgery على tendons, they get frozen repairs اللي هي part of adhesions. GI strictures or stenosis, cirrhosis in the liver, pulmonary fibrosis, or contractures in burn patients. So excessive scarring or abnormal scarring. الاشي اللي بدي تعرفوه فيهم هذول، في عنا امثله عليهم اللي هو الهايبرتروفيك سكار والكيلويد سكار. هلا هذا الجدول is essential you memorize لانه راح يجيكم definitely سؤال عليه بالامتحان. So it's really important how to differentiate between hypertrophic and keloid scar. وراح احكي لكم شو الاشياء. هلا في عندنا two types of scars, hypertrophic scarring and keloid scar. هلا الhypertrophic scar, it's limited to the edges of the wound. So عندنا هون الwound بصير عندنا limit. It happens early on after the surgery. It has a good prognosis. It improves with time. هلا الكيلويد سكار اول شيء it affects females. هيك ليش حطيت لكم صورة female. It affects يعني females more than males. It affects black race more than white race, and it's not limited to the site of surgery. It can affect the areas around. It can happen early or late following surgery. It is more symptomatic and it has a poor outcome, so it does not improve with time. نرجع للإشي هذا إنه الhypertrophic scars, they develop soon after surgery. هذول الكيلويد scars may develop months after trauma. Hypertrophic, they have good prognosis, they improve with time. الكيلويد, they rarely improve with time. الhypertrophic are not familial, but keloid scars are familial. حكينا حطيت لكم صورة female, so they are more common in females, they are more common in black, and they are luckily rare. They affect يعني adults, older kids, but hypertrophic scar affects children. They outgrow the wound areal keloid scars, and they are common on the earlobes. واحدة بتعمل ear piercing مشان تركب حلق بصير عندها very ugly scar. Sternal notch shoulder rarely crosses the joint, but those happen when scar crosses the joint or skin crease at right angle. هلا الكيلويد scars are mainly symptomatic. واضحة؟
واضحة دكتور، واضحة.
تمام. هلا حكينا لكم امثله على الكرونيك ووندز. في عندنا الفينس ألسرز، والفينس ألسرز اللي بدي تعرفوه they happen in the gaiter area which is just above the ankle. they are associated with chronic venous insufficiency. شو يعني chronic venous insufficiency؟ يعني في عنا incompetence in the valves وهذول ربنا خلق ال valves to bring the blood backward to the heart. So if these valves are damaged, the blood will become pooled in the leg. So this will lead to skin discoloration, eczema formation, induration, and venous ulceration, and secondary varicose veins. شايفين varicose veins and ankle edema. هلا هاي will lead to a inverted champagne bottle sign. بصير عندهم إشي اسمه inverted champagne bottle sign. هلا شو الميكانيزمز of chronic venous insufficiency؟ ليش بصير عندنا problems بال venous ulcers؟ يا ال valves are incompetent أو they are damaged by previous deep vein thrombosis. صار في عندهم damage by a deep vein thrombosis. وهاي الفيتشرز you have شايفين manifestations of chronic venous insufficiency. You have to know these manifestations. Mechanisms of varicose vein formation, incompetent venous valve, sorry, I just need to answer this. Hello? أهلين هلا. طيب خير أنا طيب حبيبي تسلم إن شاء الله خير. هلا حبيبي عليه السلام. طيب واضح يا شباب. So you need to know الإشي اللي هم أول إشي ليش أنا حكيت لكم هاي venous ulcers are form of chronic wounds. بدي تعرفوا manifestations of chronic venous insufficiency والmechanism of varicose vein formation. هلا هذا الجدول لازم تحفظوه زي اسمكم، الفرق بين الفينس والارتيريال ألسرز، وراح أعطيكم راوند عليهم. بس لما أعطيكم راوند بدي تكونوا عارفين هاي الأشياء. هلا البريشر ألسرز اللي هن هذول التقرحات اللي بتنتج عن المرضى البيد ريدن or wheelchair bound or patients in ICU. They get ulcerations, and هذول ulcers بيفرقوا from one stage to another. stage 1 is skin is unbroken but inflamed، في عنا erythema redness. بعدين stage 2 في عنا skin is broken، يعني هون زي لما تضرب واحد كف بصير عنا redness and بس the skin is intact. هلا stage 2 is broken, the epidermis is broken or the dermis, but it's not reaching the subcutaneous fat. واضحة؟ هلا if it's extending to the subcutaneous fat معناته we are stage 3. If it is extending to the bone or tendon, this is stage 4. واضحة؟
دكتور.
فهاي الأشياء لازم تعرفوها. هلا كيف نعرف إحنا where are the areas that are susceptible to develop pressure ulcers? It depends on the posture of the patient. هلا بتعرفوا بصورة الكافة نقلبهم ذات اليمين وذات الشمال. ليش؟ Because it's really important to move around in order to prevent pressure ulcerations. هلا if patient is bedridden and lying on his back, هاي الareas most common to involve يصير فيها pressure ulcers، فإحنا لازم نتفقدها. إذا the patient is lying on his side, so these are the areas. If the patient is lying on prone يعني على بطنه, these are the areas that are liable. The most common or most frequent areas in developing pressure ulcers is the ischium اللي هو هون, ischial tuberosity in the buttock. greater trochanter, sacrum, heel, malleolus, lateral and medial, and occiput. So هاي هم ال areas the most common. هلا when we assess an ulcer, you have to talk about the site, size, shape, surface, surrounding, and edges, edge type of the ulcer. هلا الedge, if it's sloping, it means a healed ulcer. If it's punched out, it's a syphilitic ulcer. هذول لازم تعرفوهم. ومرة جبتهم بالمينيو اوسكي قبل وجبت لهم شو بس الو طيب خير هسه باجي يلا سلام هلا اوكي so punched out, everted edge, هاي كلياتهم أمثلة عليها. When you assess an ulcer, you should assess the ulcer bed, the degree of discharge, and state of local tissue and lymph nodes. دائما لازم يعني إذا في عندنا ulcer بالleg or بالfoot, you have to examine the lymph nodes as well in the groin to assess for complete assessment. لأنه إحنا دائما نركز على الألسر وبننسى الأشياء الثانية. You have to check everything. هلا المانجينج acute wound إذا واحد هاي مش لإلكم بس I'm going to tell you يعني لساتسة هاي بنحكي إذا واحد عنده injury أنا هلا حكوا معايا I'm going to do an operation I have to go فمش راح أعطيكم المحاضرة الثانية. يعني cut wrist اللي حكوا معاي عليها. So patient had an injury to the wrist and there's a bleeding from the ulnar artery. So كيف أنا بعمل management لهذا الwound؟ أول شيء cleaning, good irrigation, exploration of the wound because there might be damage to the nerves, there might be damage to the arteries, tendons. So it's not just the artery that can be damaged, other tissue, surrounding tissue. We have to repair all the structures and skin cover. We have to cover that area, the injury. هلا إذا واحد عنده bleeding from an artery, what's the most important point to do?
نوقف هذا الفيديو.
كيف بنوقفه؟
pressure
بريشر عليه.
finger pressure. Just you put your finger at the site of bleeding. مش بتروح بتحط your whole hand because this will obscure the site of bleeding and you will not do proper pressure, but you have to do finger pressure. واضحة؟ يعني على السبوت bleeding. هلا في عندنا شيء اسمه necrotizing fasciitis and it's a severe form of infection and من اسمها there's necrosis and it involves the fascia, so it can be overlooked because these patients present with deep-seated infection. The skin ممكن يبين normal بس the infection is really bad down below, and if the patient has pain out of proportion to physical findings. يعني إذا فحصت المريض وكان بصيح وبصرخ وعنده severe pain بس skin looks fine, pain out of proportion to physical findings, this might indicate a necrotizing infection. وهم types. Type 1 is polymicrobial. Type 2 type 1 is the most common type. It spreads along the facial planes, and if you miss necrotizing fasciitis, it's definitely limb threatening and might be life-threatening. So you have to always have that in mind, especially if the patient has severe pain and when you examine him, there are no apparent physical findings. هلا الأشياء اللي the clues that can give you some information about this might be a necrotizing infection, unusual pain, edema beyond the area of erythema, crepitus, skin blistering, fever, grayish discharge, focal skin gangrene, shock, coagulopathy, multi-organ failure. So it can be limb threatening and life threatening as well. هلا مرات لما يكون عندنا huge cavity wound in a wound حكينا بدل بنخليه احنا to heal by secondary intention In order to promote that, we use something called negative pressure wound therapy, اللي هو زي vacuum. So it's called vac therapy, يعني vacuum. So the vacuum high, it brings the edges of the wound together. It removes debris. It sucks all the fluid discharge, promotes perfusion, and decreases the tissue edema and promotes cellular activity. So هاي واحدة من الأشياء that we use sometimes in order to promote wound healing. This is a summary about what we have just mentioned. وحكيت لكم الأشياء المهمة كلياتها. Any questions?
يعطيك العافية دكتور.
طيب أنا عندي عملية هسه صارت طارئة، راح أجل المحاضرة اليوم المساء بصير، يعني بودي لكم مسج متى اليوم نقدر نعملها. Is that okay؟ طيب
دكتور.
يلا يعطيكم العافية.
يعطيك العافية دكتور.
يعطيك العافية دكتور.
يعطيك العافية دكتور.